Hey y'all. All right. So I'm going to give a few moments to let anyone come in who wants to come in. Not really sure how that works for YouTube, Twitch, or Facebook because I'm used to Instagram. And with Instagram, it tells me oh, we're telling people that you're live and blah, blah, blah. And so I usually give people a second. But I'm not sure how it works on those other platforms. So I'm just going to give it a minute just in case to start talking about the real stuff. And so while I give it a minute, I'm going to take out my tea supplies because I figure it's just better to have everything ready, and I hope everyone can hear me. I have my earbuds in because it's always just, well, I guess I really didn't need to have them in for this video because no one's talking back to me in this case. Like Johnny isn't with me in this video. And I will miss them. They might join at the end, though, to do our shots together. That would be nice. It's kind of the whole point of AT. So, it's always good to do our shots together. But, they're doing hot academic shit. So it might not happen, but we'll see. But yeah, I don't know. Because, usually we get some people on Instagram. So now if no one comes in, I won't know if you can hear me or not. So I'm just have to pray, I guess. I am going to turn the fan on. I hope it's not obnoxious. I have, like I said, almost no way of knowing what it sounds like. So, yeah. All right. Actually, I wonder, should I take my headphones out? Herm. Just don't know. I just don't know. Hold on. I'm trying to decide whether or not to take my headphones out. Also, my cat's trying to destroy everything, so hopefully that doesn't become a nightmare. Okay. Hi. Hello. Hi. There she is. Hello, Clytemnestra. Okay, so hi. It's me. It's Erica. All by myself today. Like I said, Gianni's doing school things, so it's just me, myself, and I today. So, but because of that, I figured I'd take this day to do like an update, like a 7-month update, post top surgery. Yeah, so I wish it could have been 6 months, but it's technically 7 months now. It was 6 months last month, and I had my 6-month check-in with my surgeon. Not every surgeon does a 6-month check-in. Like I think Gianni's surgeon only had them do like the week to get their drains out, and then like a 3-week or a 1 month, and I think that was it. But I had my 1 week to get my drains out, my 1 month, and then my 6 months. Yeah. So I have notes. So if you see me looking somewhere, it's because I'm trying to say everything that I wanted to say. And it's kind of a weird angle because, I'm talking about my scars. So, and, my top surgery. So, I wanted you to be able to see my chest. So, I hope that doesn't freak anyone out. Yeah. So I guess I'm just going to talk a little bit about the brief, like, overview stuff for anyone who, doesn't know anything about my story or my surgery or where I went or any of that stuff. And in case that's helpful for anybody. I booked a consultation with Dr. Alexis Hazen who operates out of New York City. I booked a consultation with her in March of 2020. I believe it was March or April. Yeah, March or April. And so my consult was set up for September, the end of September 2020. And then, of course, COVID hit. So that was sort of trampled all over. So my consult was then pushed to October. And then had my consult, which was virtual. I told her I didn't want nipples. And I didn't have any, it depends on the person, whether you have much say over what your scars look like, or even what type of top surgery you get, like double incision versus like peri or keyhole, what have you. If you have mid to large size chest, then you usually have to go with double incision. But sometimes you can have a say over like how you want your scars to be. So some people want their scars to be as straight as possible. Some people want them like rounded. I didn't really have any sort of preference. I told her, do what you got to do. I trust you. Whatever is the best method that's going to work out the best, do that one. So I said that. She was really cool about me not wanting nipples. She just wanted to make sure that I didn't want nipples because I didn't want them, and not because I thought like it wouldn't look good if I got them regrafted, or just that like I couldn't have them because they would look bad, which was not the case. I just couldn't see myself with nipples, to be honest, because my nipples, if you didn't know before now, I'm going to be talking about the artist formerly known as My Nipples. So if that freaks you out, I'm sorry. But my nipples were like, I had really large nipples, and I had like, they were very not defined. Like they were very, very light. I mean, I'm a very light skinned person, so they were very, very light. They didn't have much definition. So like the idea of having just like small, like more cis male type nipples, just I couldn't picture it. I just wasn't interested. I was like, I can't see that on myself. It doesn't make sense in my head. So I just was like, nah. She was like, yeah, cool, that's chill, it's fine. And yeah, so that all went well. I then, because of this is not run of the mill, but because of a cancellation, I ended up getting a date because it was at the end of October, my consult, and the date that was offered me was a week from the consult. It was, or 2 weeks, I forget. But my surgery date was November 19th. And they were like, well, you could take the date that we have like in March available, or you could take this date because we just had a cancellation, which is 2 weeks from now. And I was like, okay. That was kind of hell on earth. It got done. It was fine. But if you're interested in more of that, I have a whole video on that on my YouTube channel. It's not on the AT YouTube channel. It's on my personal YouTube channel, but maybe I'll upload it to the other one too. Maybe. Because, it's just information. So there's that. Yeah, that has all of that. So, the thing is, part of why I loved Dr. Hazen is like, I didn't want to have to pay out of pocket because I just really didn't have that as an option at the time. I cannot imagine what it would take for me to raise the money or even fundraise the money to have top surgery, like out of pocket. It was just sort of out of the question for me. And I also just have no interest in, and this is, the main thing I wanted to talk about, alongside with the other just like generic healing stuff, is that I did not want to buy into the narrative perpetuating, I don't know what you would say, of sort of the diet culture and fat phobic claiming of top surgery, in the way that I don't believe that I have to have pecs that look a certain way to be affirmed in my gender. I didn't want to have to go through like lipo and all this stuff. Like, I have a lot of feelings about people like Dr. Garamone, who is a big surgeon in the top surgery community. If you're looking into top surgery at all, I'm sure you've heard of him. Like people like that who just sort of take advantage of the trans community in the way that like they just charge an unbelievable amount of money for top surgery. And there's this culture about like, having perfect scars and having them fade perfectly, and passing and being stealth and all these things. And, there are various reasons that people do that. And a lot of it is safety. And I don't want to take that away from people. But, as a fat person who has gone through most of my life, like, being on different diets and starving myself and hating my body and, just being generally unhealthy for the sake of looking the way that society wants me to look, like I put that aside, or I'm consciously trying to move away from that. And I did not want a gender affirming procedure to feed back into that. Like that was not at all something I wanted to perpetuate. And another big thing is BMI limits. Like a lot of surgeons have BMI limits. And again, we could talk back and forth about, why surgeons have BMI limits. There are some people who, there's this thing about if you practice in a private practice versus like a hospital. Like I had mine done, Dr. Hazen has her own office, but I had my top surgery done at NYU. Because about possible complications, people with high BMIs, all these different things, I don't want to get too much into it, but there's a culture of like, oh, your top surgery won't look good or won't turn out very well if you're above a certain BMI. And that's just not true. There are plenty of people with high BMIs, or even, BMI is a totally racist bunk system anyway. So, that's its whole thing. But I just wanted to, come at it from that direction and say that like, no matter what size your body is, you deserve to have gender affirming surgery, and you don't deserve to have people tell you that your surgery won't come out the way you want it, or you won't feel positively about it because of your weight. And so luckily, one of the surgeons who takes Medicaid is, which is what I'm on, and other insurances as well, not just Medicaid, is Dr. Hazen. And I live in New York City, so that was doable for me. So it all sort of aligned in that way. I was very, very lucky to be able to see her. She was nothing but lovely. She never brought up my weight once. It was never part of the conversation. And it was never, a question of like, oh, well, I don't know if I can do as good as results on you because you're overweight. None of that. And that was really important to me. And she, doesn't hide her top surgery stuff on her website like some people do. Like it was just important to me that she seemed to be very like to advocate for this and to not just be a plastic surgeon who does top surgery, which is, a thing. Yeah. So that was like the brief overview. So yeah, I think I did the basic overview there. So after the surgery, I definitely was not prepared for like, I've had surgery once. It was when I was like 7, and it was very like minor and not super invasive. So it's, not, top surgery isn't the biggest, worst surgery you can have either. But, I didn't know how it was going to be. I didn't know how my pain was going to be. And luckily, I was very low pain. I was able to, I think I have a high pain tolerance anyway, but I would just say generally that like, it wasn't a lot of pain that I was dealing with. And I've heard a lot of other people say that, they didn't need, like, I didn't need my oxycodone that I was prescribed. I only took Tylenol extra strength, like, for the first 2 weeks. And then I stopped having to take it. A lot of other people have had that experience, but again, it depends. Like, if you have other sort of mitigating factors, other sort of like if you have like a neurological disorder or something like that, that might cause you to have higher pain in a situation like that, then you might need to take, something a little stronger, which is fine. For me, that was not the case. I was very lucky in that regard. I didn't have any complications. The only real complication, which I don't really consider much of a complication, is that, well, the only complication was, I would say, my big piece of advice is, like, to anyone going to the hospital with someone or having the procedure, like, let them know, like, where you're going, like, like how long the procedure takes, but then also let them know, because this is my thing. At NYU, at the hospital, they like took all my stuff and put it in the locker for me. And my partner was with me, but I should have just given my phone to my partner instead of put it in the locker, because I was held longer, like several hours longer than is normal, simply because when I woke up out of anesthesia, my heart rate was a little elevated, which I guess, can happen, is common in like young people coming off of anesthesia. So nothing else was wrong. They just wanted to get my heart rate down a bit before they sent me home. So they gave me like a Valium. And they just had me like, I was also like really nauseous when I came out of anesthesia, which was not something I had dealt with before. So they just kept me to monitor that and stuff. But I would say, make sure you have some sort of advocate for you if you can, or just let your loved ones know, like, hey, if I don't get back to you like an hour after you expect me to, it doesn't mean that I'm dead. Please just, don't freak out. You can have a nurse call someone for you. Like, my mom ended up calling the nurse. Like, it was a whole thing. And they were very lovely. And honestly, the nurse used all my correct pronouns while my mom didn't. And that was really interesting to listen to on the phone. Not trying to like call out my mom, but like, it was funny. So that goes to show how great the nurses were. Yeah, so thank you to the NYU people. They were great. Yeah, so I was lucky to not have any complications in that area. I felt very fragile for a long time afterwards. Like a few weeks, like I was cleared. I could shower the day after because I didn't have bandages for nipples. It can be kind of annoying when you have nipple grafts. Like, you're not supposed to like get them wet for a week or so. And you feel gross like when you come out of surgery. So, I imagine that was, and I felt gross too, but I was terrified to take a shower. I was really scared. Like, I had my partner with me. And like, I was holding my drains up like this, but I was so scared to move or like move my arms too much or like jiggle. At one point I dropped my drain, which was fine. Like, it didn't, like, it just tugged a little bit on my thing. And I was like, like, I was so scared. It was so scary, but, it was fine. And then, by 1 month, I got my drains out, which wasn't much pain at all. And then by 1 month, I was cleared to remove the outer suture tape that was on my scars, because it just gets really gross, and you think that your scars are like still horribly crusty and scabbed over and nasty, but in reality, it was really just the tape that they put there to make sure, just to reinforce your internal sutures. But once all that came off, you realize like, oh, my scars don't look that bad. Everything looks pretty okay. So once we hit that point, I was able to start scar care, which was really scary initially. Like, you feel like you're just gonna like burst apart and you don't want to touch your chest. At least I did. Obviously that won't happen. You have internal sutures, so you're set there. But I definitely felt that fear. Yeah, but it definitely. So these are what my scars look like right now. You can see these are all stretch marks from, when I had breasts and when they grew and got smaller, because they change shape all the time. If you have breasts, or even just, pecs, they do that. But what was I going to say? Oh, in the beginning, like they were really thick underneath. Like I could feel when I would touch them, it was like really thick. It felt like the scar went to like here, you know what I mean? Like underneath. But then as I massaged them, like, you know, you just insistent, not too hard, not too gentle, and you just massage, and it breaks up all that tissue in there. So now, you know, I can feel them on the outside, but I don't feel the scars like underneath anymore. It just feels like, you know, my fat, my tissue. So for the first 3 months I did, I actually got sent home with like a tube of, what was the brand? Medica Scar Gel, which if you look it up online is super fucking expensive. Like for the Carmex tube size, it's like $50, which is what I was sent home with and I was grateful for that. But it's probably because, you know, they're a plastic surgery office, so they probably get sent that stuff all the time. So I was grateful to be sent home with that. And then when that ran out, I would do that twice a day and massage my scars. When that ran out, I got some 100% silicone scar gel from Amazon, but I found out I ended up not using it anymore. But I found out you can also just get like 100% silicone lube. The only annoying thing is lube obviously doesn't sink into your skin. Like it's not going to be absorbed by your skin. So if you put it on in massage, you're eventually going to, you leave it and then you're eventually going to have to wipe the rest off. And I used up that tube. And then when I was done with that, I tried bio oil because I knew a lot of people like bio oil. I tried bio oil. It was fine. I just didn't, I just was like, eh. And now I'm currently using cocoa butter. So I'm using that Palmer's, like the stuff you see everywhere, cocoa butter with vitamin E. I really like that. And I'm probably going to stick with that because it smells really good. You just smell like chocolate after you put it on, which is great. It's really moisturizing, and I've seen a lot of people have really great results with it. And it's also, super cheap and affordable. So, it depends. Silicone, 100% silicone products are the only thing that's been clinically tested, for what it's worth, are proven to show significant scar fading results. But again, I'm in a lot of top surgery groups, and, you see different people's results and how it's worked for them. So, it just depends. I would say try a bunch of different things. Why not? Yeah, so there's that. So yeah, so as you can see, my scars are really faded. Like in the middle here, like there's this little part where it's like there's not even a scar anymore. Under the arms were originally really dark and they're pretty light now. And then the most prominent now is just like where the beginnings of them are. I'm not sure why that is, but yeah, I mean, I've been doing scar care because, it just kind of seemed, you just want to keep your scars moisturized and protected from the sun and all that stuff, generally, just because it's good skin health. But, I was never really super concerned with like people seeing my scars. Like a big part of that too has to do with the fact that I opted not to have nipples. So, people who have nipples, who had top surgery and either retained their nipples or had their nipples grafted back on, like, you have sort of you have the ability to possibly pass as someone who was born with a chest that looked like that. Whereas I don't have nipples. So whether people see me and assume that I had top surgery on purpose, willingly, or more likely people will see me and honestly probably think that I had to have a double mastectomy, especially because I have long hair and I don't have like a beard. Like I don't have the markers that someone might pick up on as, oh, that person's trans. So, I'm still very much red as femme. So, right now people may see me and think, oh, that person had cancer. They had a mastectomy. So I wasn't getting nipples. So I was like, I don't really care. Like, I don't, I feel empowered by my scars, by having scars. I didn't really care what they looked like. Like, for me, again, like going back to this idea, like the aesthetics were secondary. Like I didn't get top surgery to look really good with my shirt off. You know what I mean? Like whatever that means. I got top surgery because my breast caused me dysphoria. And so that was my main thing. My main thing was having them gone. Like, it wasn't like having ripped pecs or like anything like that. Like, that wasn't my concern. So yeah, so, I'm massaging them and keeping them, moisturized and all that stuff, but I'm not super concerned with, whether they're fading or whether they're completely invisible. Like, I would probably never do any sort of surgery or sort of like I don't know, microneedling or whatever it is, like any of those procedures that, attempts to help fade scars. I probably wouldn't do anything like that because I just, I don't really care that much. Yeah. So I wanted to talk about like the biggest things, because once you've passed like month 3 or so, and you're massaging your scars, your all of your bandages and aftercare is pretty much done, besides scar care that you're doing. You might still have swelling and stuff, but by that point you're sort of like, you're over like the big hump, and you're kind of adapting to what your chest is like and what you feel like. And I wanted to talk about that a little bit because I didn't necessarily see my story represented in the groups that I was in, which is not to say that it doesn't exist. It's just that, algorithms and whatnot, we tend to see, a very specific subset of bodies and, skin colors, and so specifically white, thin people. And I just wanted to give more space to talk about like the really great things and also the slightly more negative things. Because there should be space for that. Top surgery and transition and all of that is complicated. It's not straightforward, even though it is life-saving for many and very important that anybody who wants gender-affirming care can receive it, whether that means hormones or just having someone to talk to about, their gender and feel like someone sees them, like whatever that means to them. They should have access to it. And the thing is that like, it's not the reason that people should have access to gender affirming healthcare is not just because it is always life-saving and always like good. There are plenty of things that we do and that we have that are not 100% good all the time, but we still recognize the need for them and that they are important. And top surgery is very similar because for me, as a fat person, like I've gained weight in quarantine, as to give you an idea, like my job, like I'm an actor and I work in theaters and stuff like that. And, before the pandemic, I was clocking several miles a day in the city and at my job. So I was just, active. I was still fat because that's just how I'm built. I'm tall and I'm broad, and everyone in my family is tall and broad and carries weight. So I gained weight in quarantine, as almost everybody has, just being less active, and that's fine. That's just phases our bodies go through, and it shouldn't be shamed at all. And then also being on T has caused me to gain weight. And that has triggered a lot of like fat phobia that I've had, internalized fat phobia. And the thing is about getting top surgery, and that I had seen a little bit of people talking about before I got it, was that people were talking about that, like, when you take your boobs out of the equation, for a lot of people, it's like you're no longer proportional, like in the way that it's like, if you looked at me from the side, my weight was sort of like a rectangle. Like I carried it like, the same way all the way down. But then, when I got top surgery, it was more like, my chest was flat. I asked her not to leave any tissue behind or anything like that. So my chest is flat, like flat. But my stomach isn't. because I've never had a flat stomach. Like I've always had some kind of fat carried in my stomach. That's just how I carry weight. And so, I had seen some people talk about the fact that they had to sort of confront that after top surgery. They had to sort of be confronted by the fact that, like, they have a stomach, it sticks out, it is now the most prominent thing. Because before, especially if you had very large breasts, that might have been the most prominent thing about you, like, or at least to yourself, like not necessarily to other people. Like, your dysphoria can really play tricks on you that way and say, like, first thing people are noticing about you is your breasts, and that's a bad thing, or what have you. But regardless, in your mind, that might have been the most prominent feature about you. And then when you remove that from the equation, it's sort of like it takes away that anxiety, which sort of opens the door for other anxieties, which is not my therapist phrased it. I like how my therapist phrased it, that like that's not necessarily a bad thing, because it's like, it's like when you sort of overcome something in therapy or in life or whatever, and then something else comes up, it's because you've been given the space to now pick apart this other thing in your life. It's not that it caused that issue, it's just that issue now has space to come out. You know what I mean? So I did sort of know that was going to happen. I knew that I had more of a stomach than I did have even before quarantine. And so when I got surgery, that was a really big thing. Like, I would look down and see my stomach now, as opposed to just my breasts. And that kind of did freak me out, because I had a long and hard history with my stomach. Specifically, my stomach is like, the big area of my body that I've felt subconscious about. And that is a very real thing that people confront. And it's not just people in very large bodies. It can be people, to a lot of people, I may be considered small fat, because I'm in comparison to other bodies, I might not have the biggest body. You know what I mean? So, but there are other people who are smaller than me who I've seen have this sort of realization or struggle. And it should be talked about, because it's something that happens. That doesn't mean that top surgery isn't worth it, because again, regardless of how sort of self-conscious I've felt about my stomach lately, and I've really struggled with it. I mean, especially in the world of the pandemic, any previous like anxieties or things you were self-conscious about, the collective trauma and anxiety that the planet is going through with the pandemic has made everybody's anxieties and fears and whatnot worse. And so for me, a big part of my anxiety that got worse was my body image issues. And yet I am thankful every day for my top surgery. Like, I am, whereas the way I put it, because I was also a person who wasn't sure for a long time whether or not not that I wanted it, but if I deserved it, because I was sort of like, well, I don't have dysphoria every day. I'm not like depressed every day because I have boobs. So like, should I even bother with it? And it's like, now after the fact, it's like whereas before my breasts, I was only ever ambivalent or what's the word? Like, not content, but like complacent. No, not complacent. Complacent. Sorry, I was thinking of complicit. I was like, but yeah, complacent, like just sort of like, to outright negative. Now my chest, it is only positive. Like, I only feel positively about the fact that I don't have breasts anymore. So even though I have been dealing with this fat phobia stuff, like that is a separate thing. Yes, of course, it is informed by my gender, and it all is sort of squiffy and together. And my dysphoria is very much linked to dysmorphia in that way. And I think, I think that's a thing that we need to talk about as well, that I think sometimes we pretend as if dysphoria is its own separate thing that we're kind of a slave to. We can't really like parse it apart or figure it out. Like, it doesn't make any sense. It's totally on its own. I don't think that's necessarily true. I think it's, you know, connected to a lot of other things in our life. And yeah, I think there are parts of it that are just sort of like, it is what it is. I don't know why it's this way, but it is. But I do think there are parts like the way it is connected to my fat phobia that, you know, that's a very real thing. And I'm dealing with that. And but I have been working to separate my fat phobia issues from my, you know, euphoria of having a flat chest. Like, and I'm trying to move away from saying a flat chest, because my chest is not flat in the way that it's like, you know, I have some tissue. Like if I bend over a little bit like this, I also might still have a little bit of swelling, because my surgeon was talking about like, you can have swelling like up until like after the first year of surgery. Like you can have swelling for a long time because your body's, you know, trying to settle and figure things out. So she said I might still have some, you know, swelling. But yeah, it's less of having a flat chest and more of not having breasts, which caused me distress. That is a good thing. It's only been a good thing. And even for people who have mixed feelings about it, like there are plenty of people who come out of surgery and have post-op depression. That's a very real thing. Things like that, like that is real, and we should talk about it. And it shouldn't be the reason that people can't have access to healthcare, because there are so many things in this life that are not that are made, that are decision based, that we have to make decisions on. And decisions are hard, even if, you know, you're someone who says, I hate my breasts, I don't identify with them, they cause me dysphoria, whatever. But you might still not know whether or not you want top surgery. You might be, you know, terrified of having surgery. You might have financial barriers. You don't have insurance. Like, there are plenty of reasons that people either don't seek out top surgery or don't even want top surgery, even if their breasts do cause them distress. Like, it's very complicated, but that still doesn't mean that because it's complicated and complex and we have to, you know, like really like plumb our depths to sort of figure out how we feel about things, it doesn't mean that it's not worth it and that it shouldn't be something that's available to the people who want it. And I'm a very firm believer in that, because sometimes I think we can slip into that. I think it's a protective thing. Again, I think it is that thing because I've said it and experienced it myself a lot, like on my Instagram specifically, that I've been afraid to address certain things because I've been worried about how they'll be received by cis people, by people who are already, you know, hesitant to let trans people have access to healthcare, who, you know, are very much of the belief that trans people are confused and that they need help, you know, that it's a disorder, like all these things. Like, it's scary to put that out there and say, like, I'm having mixed feelings about my transition. And yet, like, it's just a period in someone's life. Like, it's literally like when people call it second puberty, especially in the case of hormones, like that's literally what it is. And it's not, and that's something I had to come to realize, like when I started taking low dose T, is that like, it very much is like puberty, but not just in the, like, I wasn't really like understanding really what that meant until, it happened, where it's like, it's not just about like waking up every day and feeling euphoric all the time. Like, that's, you know, it might be for some people, but it's not for everybody. And I've had a lot of days where I've woken up and been like, ugh, you know what I mean? Like, and, you know, I've had a lot of the negative side effects that come from transition. Like, my acne has sort of come back and just totally, you know, thrown me for a loop. I have all this chest acne happening and back acne. Like, it's really annoying. I have had mixed feelings about, the weight gain and how my face is changing and all these things. Like, it's not straightforward, just like how first puberty is not straightforward. And people should not feel guilty or be scared to talk about how things are complex just because people think like, oh, because this is slightly difficult, it shouldn't be able to happen. You know what I mean? Like, life is difficult. Things are difficult. Like, that's just how it is. Like, you can't just lump it all in and say like, because this is difficult, it's bad and it shouldn't be, we should prevent people's or restrict people's access to it. It's like, I've talked about it before, but like, I really think we have such a thing. I don't know. I can't really speak for, the world at large. I can only speak from, I'm American. But, the society that I was brought up in has they don't take kindly to people who are unsure. They don't, society doesn't like the questioning. They don't like, humans generally don't like to be confused. Humans very much like labels and they like things that make sense. I mean, I'm a person, my brain really likes labels and boxes and organization, which is very frustrating when you're a person who doesn't fit in boxes or labels. But it just goes to show that like they want you to be sure, and questioning and stuff like that it's not really encouraged or supported, or we have weird feelings about it because we all want to be sure. We don't want to make mistakes, things like that. But like, I think we really need to sort of explore that and figure out like how we can kind of make room for that, because I think it's just life-changing to be able to encourage someone to just question things, and we encourage it for kids, but we encourage it in like very specific ways where it's like, you can debate with yourself whether you want to be a doctor or a lawyer. Like, that's what you get to do. Like, you can't really like question your gender, your sexuality. You can't question authority. You can't like we have very specific rules about what you can and can't be questioning or exploring. And I think because of that, we enforce sort of this narrative of like, you have to be sure. If this is something you really need, you have to be sure. And like, I experienced that when I got surgery, because I had to tell a lot of people in my family, I'm getting top surgery. And a lot of them were like, this is a really big decision. We really hope that you're sure. And it's like, you know what? I mean, I was sure, but at the same time, why does it matter to you? Because like, yeah, if I was unsure and I was unhappy with how things turned out, that would be rough. It would be hard, and that would be hard on my mental health. But it's also my body. And people reacted to me talking about my top surgery as if it was something that was happening to them. And it was just so wild, because it was like, you do realize that I'm the one who's getting my boob chopped off, right? Like, it's not you. And so people they wanted me to be sure. And I was like, and it felt very much like they were trying to tell me that they weren't sure. And it was like, well, that's fine if you're not sure about my decision, but I'm sure about my decision. But even if I wasn't, like, it's not about you. It's, I made this decision, and the autonomy to be able to make the decision is sometimes more important than the decision itself. Like, I fully have felt that way. Like, many weeks where I've been like, I don't know how my transition is going. I don't know how I feel. I don't know if I want to keep taking tea like this forever. I don't know. Like, even on those days, I still like taking tea for the fact that it is something that I chose to do myself. I went through all the channels to get it myself, and it's something I do for myself and not for anyone else, and that's big for me. Now, there was one thing I wanted to talk about that, like, it's kind of late now, but like I still have plenty of time to talk about it, so I'm going to try and talk about it a little bit. Oh, sorry. Is revisions. So, a lot of people, or many people, who get top surgery may seek out revisions, which there are different things that can happen there. A very common thing is dog ears, where it's just you have like extra skin on the sides of your chest. Oh, hey, Johnny. I'm going to let Gianni in here in a second so that they can talk. Okay, yes. Hey.
Hi.
So glad you could pop in.
Likewise. Yeah, I was not looking forward to doing this by myself. I was like, wait, do I know how to do this by myself?
No, I know. I didn't want to do it by myself either. I don't like doing it by myself.
But I don't want to cut you off. I know time is tight. I want to hear what you have to say on revisions.
Oh yeah, I just want to make sure, like, I want to make sure that we can do our shots together. So, but I'll just finish up where, like, I talked to Dr. Hazen about my sides, because I have this weird thing going on with my sides. It's not quite a dog ear in the way where it's like, it's not just like skin, it's like fat. It's because, like, you know, I'm a big person and it's basically side boob, but it's not side boob. You know what I mean? Because it's not breast tissue, it's just fat. And I felt really weird about it because, like, when I put my arms down, like, I just have like this little like that happens. I felt weird about it because it's like the fat phobia thing I was talking about. It was like, should I just accept this as a part of my body? Because I'm trying to accept the other parts of my body that just are fat, have fat, whatever.
Right.
And also the other part was like, if I tell her, you know, is she just going to be like, well, you have a large body, like that just is what it is. And like, she wouldn't be wrong, but my brain was just sort of scared for that because of, you know, years and years of people telling me that, you know, I don't like a certain thing because I'm fat. And if I want to be happier, don't be fat. But she didn't say that. She said that, you know, if it bothers me, we'll give it another few months just to see, because again, swelling can happen for a while after surgery. So she said, we'll give it a few months, and if you're still uncomfortable about it, you can come in and we can talk about it and talk about a possible revision. So, you know, I'm still very up in the air about it. I don't know how I feel about it. It feels kind of like, I hate to say traitory, but yeah, it's that weird feeling of like, you know, this is a result that I'm having post-surgery. Does that mean that you know what I mean? It's that thing we've talked about. Where's the line of like modifying your body? Like, at what point does it become like, is it actually detracting from my self-love to keep changing it because it doesn't look the way I want it to? You know what I mean?
Right. Yeah, no, that's definitely like an intersection that has a lot of layers and a lot of I could see how, even depending on the day, your feeling on how to proceed might change, right? And I came in at the very end of what you were sharing about the decision-making process of whatever you want to do to your body, whether it's gender-related or not, and this like societal pressure, whether it's, you know, so that the body aligns with what Western ideals are, or, you know, whether it's familial pressure. And another thing that this makes me think of in your case in particular, what does a revision mean according to the doctor, and what that looks like for you from like a health insurance perspective, because it's, you know, like and it's different going through your insurance, I think, of being not insured, going to a private practice, even if it's pursuing the exact exact same revision, like how financially that plays out, if it's a question of, fat and not breast tissue, how that gets, what that looks like on paper and then what that means financially, is something else that comes to mind in regards to what you were saying. But yeah, I mean, I'm here, and I think it's an important conversation to have publicly, to really unpack like the our, we can call them body projects or not, right? And the factors and the way in which we prioritize those factors when making those decisions.
Yeah, definitely. Yeah, it's definitely something I want to talk about more, and just really, because I have a few months before, I see her. And so, yeah, it's definitely something I'm thinking about, but it's hard. It's one of those complicated things.
It sounds like you had a good conversation with the doctor, though, right? Like,
yeah, she was great. Like, I was anxious because I'm always anxious, but she was great. She's been great about everything. So, at least I don't have to worry about that. Today is one of those days where I'm going to be trying to squeak out the very last of my juice here. You're getting to the end of yours too, right?
I will have enough to make it to my appointment, which is in 2 weeks now, 2 or 3.
But it's a close thing.
Yeah, and even like pulling it out is a close thing too.
Yeah, because then it's like you said, it makes that hole, especially because the syringe or the needle that you use to pull it out is bigger, a bigger gauge than the one you inject with, so it like punctures a bigger hole.
I guess you can't see it quite in the video, but because I've obviously punctured this many more times than you puncture the small vials.
Yeah.
So look, the rubber's all beat up.
Yeah. It doesn't take much.
Yeah.
Yeah. So, like mine, like it makes me nervous because it has bubbles in it, which again, my friend was like, if it has a few tiny little bubbles, you're fine. But my brain is like, bubbles. Yeah, see, I have like quite a hole in there. Still to this day, even though I know this size needle is not the one that's going in my body, I still don't like looking at it.
Yeah, I'm the same way.
Funny enough, I was at a friend's apartment that they are renting, and the roommate all of a sudden was like, I hope you guys aren't bothered by injections. I have to do my IVF injections. And I was like, well,
tell you about injections.
Let me tell you, I was kind of jealous though, because she was doing subcutaneous, so it was like in her belly, and it was like only that long.
So, interesting.
Yeah. All right. Well, we good to do deep breath time?
I'm here to support you.
Say hi, Michael.
Hello.
Hi,
Do a deep breath.
This is Michael.
Do a deep breath. It'll be so good.
Thanks so much for your support. Okay. All right. Deep breath time. You good for deep breath time?
All right, let's do it.
All right. Okay. So in and back out. And one more in and back out. That was nice. I needed that. Okay. All right. Left leg today, so it's a bit of a challenge.
I'm right today.
Good old right leg. Okay. All right. Okay, you ready?
Yep.
All right. 1, 2, 3. Ow.
I fucked that up.
I didn't squeeze. I just realized that might be why it hurt a little bit more than it usually does. I didn't do the squeezy bit. Do you do that where you like squeeze?
I have in the past. I also realized I had a lot of air in here. Now I don't know what I'm doing.
Listen, it's the end of the vial syndrome. It just gets messy. Gets real messy. Get in there. Ugh.
Sorry, that was a lot. I was not prepared. Oh. Anyway.
Yeah, mine was
Oh,
quite
my
the
best.
pinch.
I'll just leave that there.
Mine was the pinch that you expect anytime you get a shot, where you're like,
Yeah, I think there's something
You're-
to say about the what you were saying of like the joy of weekly shots and it being, it like punctuates the week. In the weeks that we were consistent on doing AT, that it's just that space that gets you like mentally situated for the shot, and it's interesting to experience how like coming in from a meeting to hopping in, kind of like interjecting while you're in the middle of this, like jumping to the shots and jumping back to the meeting. Like there's something to say about like how we have been approaching our shots and the 45 minutes we spend. I don't know. Like I don't want to say in fellowship. Like fellowships feels like such a big word, but you know what I mean. Like just like connecting on this, that then leads to this other thing, which is like what keeps us connected. Not to say that like taking the shot's the only thing that keeps us. You know what I mean?
Yeah, it's just taking something for yourself. Like it's like I think we often forget to do that. All of us to just do something for yourself. And it feels nice to be like, no, this is a thing that I have to do.
Yeah.
Right now, I do this every week, so I'm doing it.
And how different it feels. Like I feel a little like, although today, in this week, I don't have a lot of control of what like my Friday looks like, and it's a little bit out of like my hands to have been able to like do the hour with you. But it was still something that I was like committed to like showing for.
Yeah, no, it's nice to have something that you show up for every week for yourself, and yeah, it's nice, and it is always nice to not do it by yourself.
I'll have to come back and watch the first bit.
Yeah, it was weird talking to myself all by myself for so long, but
It's been a while, right?
Yeah, but thanks for hopping in. I was glad to have you, and have a good rest of your day as much as you can. And we'll see you next week, and take care of yourselves and take care of people in your life, and see you later.
All right.
Bye.